Isibloom is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Isibloom may also help make periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases, so it's important to use additional protection if needed. The daily dosage of Isibloom is typically one pill taken at the same time each day, and the best time to take it is usually in the evening or at bedtime. Before you start using Isibloom, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Make sure to take this medication exactly as prescribed by your doctor, and do not skip any doses. If you experience vomiting or diarrhea, use a backup birth control method such as condoms or spermicide. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. You may experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change while taking Isibloom. You may also have vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these side effects persist or worsen, notify your doctor or pharmacist. This medication may also increase your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes high. Serious side effects may include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, Isibloom may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek medical help immediately if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, weakness on one side of the body, or vision problems/changes. While allergic reactions to this drug are rare, seek immediate medical help if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. If you smoke cigarettes or use tobacco and are over 35 years old, do not use Isibloom. This is because smoking can increase your risk of stroke, heart attack, blood clots, and high blood pressure from hormonal birth control like Isibloom. The risk of these serious problems increases with age and the number of cigarettes you smoke. So, it is important not to smoke or use tobacco while taking Isibloom. Before taking Isibloom, make sure to inform your doctor or pharmacist if you have any allergies to estrogens or progestins, or if you have a history of certain medical conditions such as blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, or thyroid problems. If you have diabetes, monitor your blood sugar regularly and inform your doctor of any changes. If you are diabetic, have phenylketonuria, or need to avoid sugar or aspartame, be cautious when taking chewable tablets. If you are planning to have surgery, be sure to let your doctor know that you are taking Isibloom, as it may increase the risk of blood clots. This medication may also cause skin discoloration, so limit your time in the sun and use sunscreen. If you wear contact lenses, be aware that you may experience vision problems. After stopping this medication, it may take longer for you to become pregnant. Do not use Isibloom during pregnancy, and if you become pregnant while taking this medication, notify your doctor immediately. Additionally, this medication may decrease breast milk production, so consult your doctor before breastfeeding. When taking Isibloom, it's important to be aware of any potential interactions with other medications. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Some products that may interact with Isibloom include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, and certain combination products used to treat chronic hepatitis C. It's also important to note that some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. These include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, be sure to inform your doctor and discuss if you should use additional reliable birth control. Additionally, be aware of any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working as well as it should. Lastly, Isibloom may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Isibloom and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Isibloom with others. Make sure to have regular physical exams, which may include lab tests and medical exams like blood pressure, breast exam, pelvic exam, and pap smear while taking Isibloom. Follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. If you need more details, consult your doctor. If you miss a dose, refer to the product package for advice. You may need to use backup birth control to prevent pregnancy. If you have any questions, ask your doctor or pharmacist. If you frequently forget to take your pills as directed, contact your doctor to discuss switching to another form of birth control. It is important to store Isibloom at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush Isibloom down the toilet or pour it into a drain unless specifically instructed. When the medication is expired or no longer needed, it is essential to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Isibloom. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.